Sharma, Chairman of Empowered Group on Technology and Data Management and Chief Executive Officer, National Health Authority, to set the context for today's conclave with his keynote speech. Dr. R.S. Sharma, an ex-Indian Administrative Service Officer, is currently the Chief Executive Officer of the National Health Authority of Government of India. He is also the Chairman of Empowered Group on Vaccine Administration for COVID-19. Sir was the Founding Director General and Mission Director of the Unique Identification Authority of India, which launched Aadhaar, the world's largest digital identity platform. Sir has been a champion of technology-driven governance and has led a number of e-governance projects at union and provincial level during his illustrious career spanning over more than 4 decades. Over to you, sir.
Thank you very much, Dr. Harshvardhan, Honorable Union Minister of Health and Family Welfare, Mr. Rajesh Bhushan, the Union Health Secretary, Mr. Harshvardhan Shringla, Foreign Secretary, esteemed excellencies, distinguished panelists, and my dear friends from India and abroad, the COVID Global Conclave. Namaskar. We are all assembled here today to share our thoughts on the COVID Global Outreach Program that endeavors to share this tech-enabled vaccination platform as a free public good with the world. When the subject had come up in a meeting on vaccine administration recently, it was our Honorable Prime Minister who had told me with an absolute resolve that we should do everything with the objective of helping others, including sharing of our COVID platform with the world. I feel happy today as we take the first step towards realizing the vision of our Honorable Prime Minister. It's a known fact that nations across the world are endeavoring for universal vaccination amidst the steepest timelines. It is clear as we thrive in the age of digital in the 21st century, we cannot rely on methodologies from a century ago of achieving herd immunity by letting a pandemic leave the society devastated, like the Spanish flu did. Persistent immunization is going to be, by far, the most effective means to keep our people safe globally. However, even with the availability of vaccine against COVID-19 now, the challenge for equitable distribution across geographies still stands tall ahead of us. Though we have previously seen success stories of eradication in smallpox across the world and polio in India, these efforts have spanned across decades, with ailments spanning maybe even centuries. The virulent nature of this virus and its highly infectious nature does not provide us with the luxury of time as in the previous cases. Such past experiences and current developments have shown us that extreme speed, smooth coordination, and vaccine efficiency are paramount to counter a pandemic such as the COVID-19. We also foresaw the need to balance these three while also providing individual agency and flexibility to vaccination centers and people alike. This is tricky for any country, but it is even trickier for India, given our population size of over 1.3 billion, along with the cultural, linguistic, and geographical diversity with the federal structure. This is where COVID stepped in. COVID, or the COVID Vaccine Intelligence Network, has been serving as a tech backbone of one of the largest vaccination programs in the world. Launched by our Honorable Prime Minister on 16th of January 2021, the COVID portal has scaled rapidly amidst a turbulently evolving landscape. It fills me with pride to share with you that COVID has become the fastest tech platform in the world to amass over 200 million registrations in a record 4 months, and then 300 million registrations in a mere 5 months, yet another record. What adds more credibility to this achievement is the sheer scalability of the system, which is entertaining over 1 billion HTTP requests on an average daily. However, the success of COVID has not been an overnight miracle. The achievement of this feat has been a result of a decade-long digital journey of the nation that started with Aadhaar, a universal biometric digital identification system and caught lightning speed in 2015 with the launch of the Digital India Initiative. A serendipitous arrangement of public digital artifacts has shaped this digital journey for India. The journey began with providing a digitally verifiable identity to all Indians through Aadhaar. This layer of identity was topped by a system of digital delivery. Having covered the entire population with a digital identity, we have facilitated over 9 billion electronic KYC transactions and over 56 billion digital authentications. Another offshoot of this was the rise of UPI, or the Unified Payment Interface, which was launched in 2016. The interoperable payment system has witnessed over 2.7 billion monthly digital transactions, worth over 67 billion monthly. And today, on a monthly basis, it accounts for more transactions than debit and credit cards at POS terminals combined. The flagship programs such as Digital India and Janadhan Aadhaar Mobile, which is JAM Trinity, has led to the transformational foundation of digital empowerment for all. We now have community service centers in more than 240,000 gram panchayats out of 250,000 across the country that are working as centers of digital empowerment of the people. This has been facilitated further by a telecom revolution in India that has taken the number of wireless internet connections from 70 million, a mere 70 million in 2014 to 742 million today, a tenfold jump in 7 years. The average monthly data usage per user in India has increased 20% year on year to 13.5 GB in December 2020, which is with the cost plummeting by 95% for 1 GB of data from $4 in 2014 to 20 cents per GB today. India's mobile network transports more data than the corresponding mobile networks of US and China put together. India is probably the only country in the world where people in rural areas watching films on their mobile. Taking a cue from the success of such scalable and interoperable systems, today the CoWIN platform is not only handling the overall management of citizen registration, appointment scheduling and certification, but it has also ensured vaccine accessibility and inclusivity for scheduling and certificating. All. It has helped with efficient vaccination utilization and decentralized system of governance and management. Being a single source of truth, CoWIN provides a transparent system that enables end-to-end traceability of vaccines. With interactive dashboards accessible to all stakeholders alike, we remove information asymmetry from the entire ecosystem. This not only ensures equitability, but also checks rent-seeking behavior over distribution at nodal points. This aspect of CoWIN also turns it into an active feedback tool for us. As policymakers, we are able to evaluate each brand of vaccination and make data-driven decisions for public health policy. Such an AEFI data system would be our early warning system to pause or in extreme cases even terminate the rollout if a vaccine were found to introduce unacceptable side effects. In addition to this, CoWIN has been instrumental in influencing the vaccination administration policy as well. Early learnings from implementing CoWIN taught us that a supply-driven approach may inevitably result in lower efficiency of vaccine centers. This helped us to take a demand-driven distribution approach and also make booking second appointment flexible at any center. As a result, we have achieved an administration of over 350 million vaccine doses in India, as the Honorable Prime Minister just now informed. With at least 284 million Indians receiving at least one dose. This means that almost every third Indian above the age of 18 years has received at least one dose. And the ticker is climbing new peaks every day. Recently, on 21st June, we recorded the highest number of vaccination in a single day. That is over 9 million doses administered in one day alone. In India, as we are looking to scale our vaccination efforts further, we believe that the partnership with the public and private sector is quintessential. The beauty of CoWIN's architecture makes such collaboration even simpler. With an interoperable design, COVID has been designed as an amalgamation of open APIs. This allows private and public organizations to build on top of the COVID platform, while all systems continue to talk to each other and maintain that single source of truth. In this open design of COVID, that is allowing us to share it with the world as public digital good. Countries interested in availing COVID enjoy the liberty of customizing and modifying the platform as per their needs. What makes the system highly configurable is its dynamic and evolvable design and parameterization of inputs. This allows us to add new and concurrent developments and also add the brands of vaccine on the fly while adapting their administration schedule based on research and developments. It is exactly this dimension of the platform that makes it inclusive and accessible to all, as there is no black box of rules. As this pandemic has taken its toll on nations globally, the gaps in the healthcare delivery have become more apparent than ever. In India, we want to continue to build the success of COVID to address these gaps and invest in the development of the tech infrastructure for healthcare. As you will hear in the session later today, we are now focusing on creating a national digital health program, which in a couple of years will ensure that the entire country is connected through a grid that connects and validates the identity of patients, healthcare providers, healthcare facilities, and pharmacies. All these stakeholders will get connected through an open and interoperable grid that will leverage the extensive internet connectivity and the robust digital identity Aadhaar, helping plug the current gaps in healthcare delivery. Now, as my address comes to a close, I would like to use this opportunity to show my gratitude to our Honorable Prime Minister, under whose directive COVID has come to fruition. I also want to thank all my colleagues that have worked round the clock to build this beautiful technology that is enabling a smooth and effective vaccination campaign for India and hopefully for the world tomorrow. I would now conclude by quoting from our holy scripture, the Bhagavad Gita, calling all nations to be more agile in achieving the target of universal vaccination by 2020. What it means is, just as a tender plant is easy to cut down, the same requires much more effort when fully grown. Likewise, any disease is manageable in the early stage. It becomes almost incurable when it grows. Thank you. Jai Hind.
Thank you so much, sir, for setting the tone and tenor for today's event with your intuitive speech. And now, I would like to humbly request Dr. Harshvardhan, sir, Honorable Union Minister of Health and Family Welfare, Government of India, to unveil the video on India's COVID journey and grace this event with his speech. Union Health Minister Dr. Harshvardhan, sir, is an ever-dynamic, high-integrity politician with a scientific temper. His enthusiasm and determination about empowering India knows no bounds. A human with a mission, some laud him for his contribution towards eradication of polio, while others revere him for his anti-tobacco mission. In June this year, the World Health Assembly has honored him with Director's Medal for his contribution in the field. With his tenure as the chairman of the executive board of WHO coming to an end, he has recently taken over as the chairman of the Stop Tuberculosis Partnership Board. He is also a member of the Global Alliance of Vaccines and Immunization Board, dealing with global policy on vaccines. As the Union Health Minister of the world's largest democracy, Dr. Harshvardhan has been bravely leading the war against COVID-19 pandemic under the benevolent leadership of Honorable Prime Minister Sri